Welcome, everybody. I'm Jason Rivers, the founder of Riversol Skincare. And with me today is my wife, Dr. Helen Heacock, who's an epidemiologist, which is very appropriate now that we have a pandemic going around. You can ask questions about pandemics if you want to. But our purpose today is to answer your questions related to skincare in general and to Riversol in particular. To begin with, though, I do want to speak a bit about the COVID-19 virus and how it does impact us all. You've probably heard there's all kinds of potential cures for this. None of these are at this time substantiated. People have talked about using zinc and other supplementary measures to reduce your rate of getting the virus or preventing the virus. Other people have talked about certain drugs, antiretroviral drugs, and anti-malarial drugs such as hydroxychloroquine and azithromycin, which is an antibiotic. They may be of some benefit, but the clinical data is still quite weak on them. And so for now, the key thing that it's important for you to know and what you've been hearing is about keeping your hands clean and keeping your hands off your face and social isolation. The virus in general is transmitted through coughing, sneezing in a droplet fashion, but it also can be aerosolized, airborne. And that's why the issue about wearing masks is so important and why healthcare workers are using N95 masks in particular. I think the key thing, though, really for us at home is hand hygiene and again, isolation. Remember that if you're washing your hands several times a day, it is going to have a negative effect on the skin barrier. And the skin barrier is a way in which itself keeps viral particles out of the body's environment. So if you're going to use cleansing, it's important to wash your hands properly. And that's really a 20-second wash where you're washing your palms, your backs of your hands, your fingers individually, and also your thumbs. So these are areas that have to be considered. After you wash your hands, it is totally acceptable and probably preferable that you use a moisturizer on your hand to help preserve the barrier function because I've already seen people in the general public who have had hand dermatitis as a result of overwashing. And the same could be said for wearing a face mask because if you wear a face mask for too long, your sweat and the humidity can cause skin irritation and sometimes skin erosions where the skin can peel off a little bit. So you want to make sure that after every couple of hours, if you are wearing a mask continually, that you adjust the mask, you dry the skin, and again, you can put on a moisturizer or a barrier cream in advance of that. Just so you know, a soap is a good thing to use to keep your hands clean, but also the virus is killed by 70% isopropyl alcohol. And for those of you who aren't aware, in the last week, we have come up with a 70% isopropyl alcohol spray, and we've had a very positive response to this naturally. We're creating this in a non-profit fashion. That is that the cost for us to produce it, to ship it, is being transferred to the purchaser. So for $5, you will contribute to providing this free of charge, including free delivery to community centers that require these products. And we have about 17,000 on back order at this time. Within a month, we're going to have a hand gel, like a Purell style type of product that you'll be able to use on a regular basis to cleanse your hands when you don't have soap. So I'm very excited about that aspect. Just one sec. Okay, we have some questions now, which Helen will lead us off on here.
Hello, everybody. So we have our first question from our online community, Jenny in Ontario. She is in her late 20s and has become more interested in her skincare and anti-aging. And she asked if there's such a thing as starting anti-aging regimens too early. I'm sure you've seen that type of question. She says she already moisturizes and uses sunscreen every day. And is there anything else she should be doing, adding to her skincare routine right now?
Well, good question. I think the key thing really comes down to the basics, and that is uh, overall general health is important. So, first of all, good diet. Second of all, don't smoke because we know smoking plays a big role in causing premature aging of the skin. And third, keeping your skin clean because we also are becoming aware that environmental pollutants can have a negative effect on the composition of the skin. The cornerstones of treatment that you're doing, which are sunscreens and a moisturizer, is really what you need at this age. And unless you've had other interesting problems with your skin, like acne or eczema, then I think you're doing a fine job. Uh, I don't recommend for people to overdo application of products to the skin. Less is more, in my opinion. And so, generally, a good cleanser, um, a good moisturizer, and a sunscreen. And if you're in your 20s, that's probably the majority of what you're going to need.
Is that it?
That's it.
Okay, so we have a COVID question, and this is Anastasia. She has asked if there is a second wave in the epidemic or the pandemic, and I have recovered from the virus. Can I get it again?
Well, Anastasia, I'm not a virologist or an immunologist, but it would suggest that if you've had infection from COVID, this strain of COVID, then the likelihood is that you're not going to be getting sick from it again, or at least as sick. These viruses, like the flu virus, can mutate each year. And so that's why a flu vaccine that you get this year is not the same as the one that you may need next year. But certainly, I think this does give a very strong um, message to us all about vaccinations. COVID is a new virus that nobody's seen before, and as it spreads through the population, it has variable effects. A lot of people are shedding the virus and passing it asymptomatically, so you don't even know they have it and they can transmit it. There are people, the majority of whom have relatively mild disease. But then you have older people who are at risk for getting extremely severe disease and even dying from it. And that's what we're hearing. And these are people who have what are called comorbidities, such as lung disease, asthma, hypertension, liver disease, kidney disease, heart disease. Um, Suggested certain medications may also play a role. But the summary of your question is we think that if you're immune, then at least from the next wave of this virus, you should be okay. Unfortunately, I think we're going to be seeing ongoing waves of this until we get what's called herd immunity, which means that there's enough people in the population who have had the virus where it now doesn't get to move forward anymore.
Okay, I have another COVID question. Sabra saying, is it safe to order products online right now? And then she asks, what product do you recommend for age spots, facial discoloration?
Okay, ordering online. I alluded to the fact before that um, people can transmit the virus asymptomatically, and one of the ways that it can be transmitted is through materials which are called fomites. And this can include cardboard, plastic, certain metals, and the virus will live for variable periods of time on these different particles. So if you order online, I think the likelihood, first of all, is low that you're going to contract the virus. But what I would suggest you do is that if you have a package, let's say a box, and you have a tube or a jar within the box, you can open up the box. You then wash your hands and withdraw the container within the box, discarding the box. Um, so long as you're washing your hands between events and not touching your face, I think you're fine to deal with the problem. The same goes for buying groceries. That I think that if you're purchasing product that's in a plastic container or fruit or produce that may have been handled by other people, you're going to want to wash those as well. Now, on to your skin question. This was about age spots. And I think you just
It's disappeared.
okay. So age spots. Basically, we have the river salt corrector. Now, this um, doesn't contain hydroquinone. Hydroquinone is being the gold standard for lightening skin discoloration. It is still a very safe ingredient, in my opinion, but several countries have banned or eliminated its use because of overuse and use in very high concentrations. So we use a number of different ingredients in ours, including tranexamic acid, which is a very interesting molecule. It's being used a lot, especially in Asia and safe molecule to use to help lighten skin, though all these products take about 3 or 4 months to maximize improvement. And even then, you still may need to have a laser, for example, remove really resistant lesions that won't come off. Of course, there are other things to consider. Glycolic peels may help a little to lighten the pigmentation. And most important also are sunscreens because a lot of these products and a lot of these conditions are related to sun exposure, and thereby blocking the sun exposure can help to reduce the rate at which these spots appear or darken.
I see one here that says, what's the difference between dark spots and age spots?
Dark spots and age spots. Okay. It really depends on what you're looking at. Age spots are traditionally also what would be known as liver spots, and people see them on the backs of their hands, sometimes on their face. These are flat, light to dark brown patches, or what we call macules, stains. They're not related to any liver disease, they're related to sun exposure. Dark spots, on the other hand, can be any number of things. They can also be what we call lentigines. They can be age spots, which are called seborrheic keratoses, which often run in families. They're seen on the trunk in women, especially under the breasts or areas of pressure along waistbands. Totally benign, and that distinguishes the two as well.
I have another question here. This one's from Hardeep. Hardeep asks, can you tell your skin type, for example, combination or normal to dry? How do you decide what products to order?
Okay, well, basically, if you have a normal skin, you'll see that the products themselves, when you go to our website, will give you information on the type of skin that you have and will match that skin type to the product recommendation. Now, that doesn't always work for people. The key thing about our products, and some people say, well, I get scaling or I find it too drying, is that you use at times too much. You have to acclimate your skin to the product line, and really less is more. So the products do go a long way. If you've used them in the past, you'll know that. And a small amount, like a fingertip amount, is usually adequate for most of a cheek or even sometimes two cheeks. So use less than more. If you're using a thicker component, like the hydrating concentrated cream, then you might even want to mix a little bit of water with it to thin it a bit if you find it too rich for your skin.
Okay, there's another question here. I'm not sure who it's from, but it says, I am 46. I have been using your product, and the left-hand side of my face has a rosacea outbreak. I have previously used oral antibiotics that helps, but it hurts my stomach. How can I eliminate this?
So I'm not clear though, um, is the outbreak just on the one side as a result of the product, or you had it beforehand? And my guess would be that you just have this persisting on one side of the face. Well, first of all, rosacea is a chronic condition. There's no cure for it. We can help to reduce the symptoms of it. There are trigger factors which are also causative in rosacea. And guess what? If you're living in the time of COVID, which is stressful, that can be an aggravating factor for people. Um, Changes in temperature, heat, um, exercise can play a role. It used to be thought that caffeine was playing a big role, but more to the point, it's the heat which is causing dilation of blood vessels. If you're having the problem on one side of your face, um, that can happen, though usually rosacea affects the skin um, bilaterally. Had it beforehand. Okay, so she said she's had it beforehand. So the bottom line is that I would say for Candiana that you would want to use the Riversol product line, the serum and the moisturizer on a regular basis. I think that if you haven't responded to an oral antibiotic, there are other topical agents that you can consider, which are prescription. One of them is called um, Rosiver, which is topical ivermectin. And just as an aside, some people are actually looking at ivermectin as a potential treatment for COVID-19, but you don't want to start eating the cream, so we'll skip that part. So I would say there are other agents that you can use for your rosacea. At times, if the antibiotics don't work, then we also will step it up and even use very low dose Accutane, which can be used for a few months to good effect.
Okay, Claudia Perez says, I'm 49 years old and this, I used the set for very dry skin together with the corrector and loved it. But unfortunately, I do have dark spots on my cheeks and they look very bad. Do I have to add something else to my routine?
Okay, so Claudia, I would say to you that first of all, our topical agents and any topical agent won't necessarily clear every brown spot. Some of these do need to be physically removed either through destructive means like liquid nitrogen or what like I do a lot of is laser work, and those can help to eliminate the brown spots. Sometimes chemical peels will also help. So glycolic peels will help to lighten this. If you're stuck at home and you can't get out for the next few months, old traditional uh, means such as using lemon juice with the citric acid in it can help to lighten these as well. Good luck.
Okay, so Victoria Ann from the online community wants to know, Jason, Dr. Rivers, if you were trapped on a desert island with everything you needed, but you can only bring a lifetime supply of either the corrector or the anti-aging serum, which would you choose? You have to realize that you also have ample supply of sunscreen, moisturizer, cleanser, and your wife with you.
Okay, trapped on a desert island. Maybe I'll have to be the corrector. Um, well, for me, that's an easy one. Um, I would probably bring the serum, anti-aging serum. The reason is that I like it, assuming I'm able to shave on that desert island. I like to use it almost as an aftershave because it's soothing to the skin. And I personally don't have a lot of brown spots, so I don't need the corrector right now. And so I'm good to go. course, I have Helen and her supply of corrector. Okay, how about some over here? Okay, Cheryl is asking, will you be working on a hand cream for age spots to help slow down the aging process? Well, that's a good question. We're going to be coming out in the next while with a hand cream, three-plysin based hand cream. And three-plysin itself also has an effect on reducing pigmentation through blockage of an enzyme called tyrosinase. So I'm not going to guarantee that it's going to make your hands look like they're 20 years old, but that should help in terms of overall care for your skin. And we're also in the next month or two coming out with a new body sunscreen, an SPF 40 uh, water resistant, I hope, sunscreen, which is with zinc oxide only, so no chemicals within the sunscreen.
Okay, so excuse me if I've got your name wrong, but it looks like it might be Hanali from the Facebook page. Loves your products. I'm using them for about 6 months, but she's a bit concerned about breakouts. Do you have an acne product coming out?
Okay, Holly, you're not a plant, right? So the answer is yes. I'm actually quite excited about this. We've been working with a PhD chemist from UBC, and she's developed a means by which we can create an antimicrobial uh, and very safe agent that can be applied to the skin for acne. We've been testing it for about a year and a half now, and we're hoping that it will be on the market in the next, I'd say between May and September is what we're hoping for. So hold on to that, and we'll get back to you about this exciting development.
Okay, so let me have a quick read. Good question. So, Dieppe Live wants to know about changing products depending on the weather. This Dieppe's skin is normal to dry and got the dry skin products. And the more, I'm sorry, I don't know if Dieppe is male or female. And the more Dieppe used, the more the skin got flaky and drier. What should
Okay,
Dieppe do?
so this is something I alluded to before that some people. First of all, let me clarify and say this, as you all probably know, is one of the reasons that we sample Riversol and we sample it for free so that you can get to try it. I'm the first person to admit that um, our product line is not perfect for everybody, uh, but it's worth trying it. If you try it, you don't like it, there's no harm, no foul. That said, some people who do use the product, especially if they use a lot of it initially, will find that the skin can paradoxically seem to get drier and more scaly. So that's why I say instead of using more, use less of the product. And you may even want to mix it with a little bit of water in the palm of your hand with the cream. And see how you do with that. Only use one product for the first week or so, and then add more products as time goes on. So I start off with a moisturizer and then add the serum to that if that's what you're doing too. Now, in the more warmer weather, when we have more humidity, then you might also consider using a lighter product like the lotion rather than a heavier moisturizing cream. Hopefully that helps your question and answers it. And what do we have here on the side? Uh, Somebody asked about um, using different products on. Let me just back
I
up.
have one
So,
here if you want.
somebody asked about using the gel cleanser or the cream cleanser interchangeably. No product doing that. And these are just scrolling. There's one here. Uh, This is about exfoliation. So Cheryl says, I am, sorry, this is scrolling on me a bit. Cheryl just disappeared.
Well, while you find it, I have one here.
Okay,
Sunny
sorry.
asked, what do you think about teens using the product? Sunny has used a bit of the anti-aging serum on acne pimples to help with acne and wonders if that's okay.
That's perfectly fine to use the products on young individuals. And there's a question that I'll address in a second from someone else. Um, I have no problems with people doing that. With regards to acne, I think you'll find that the acne preparation that we're coming out is, first of all, it's not generally drying on the skin, and it has an effect on mild to moderate acne. So when it comes out, you'll be able to use that. So I have no problems using the cleanser, moisturizer. On somebody who's a teenager, I don't think they need to do much more than that. Just keeping it very simple. Clean the skin, moisturize the skin, use a sunscreen. There's also a concern here. Somebody mentioned about a concern about propylene glycol. There is a group called the Environmental Working Group, EWG, in the States that sort of analyzes every product out there. And unfortunately, it doesn't always give the most comprehensive data and helpful data to the population. Propylene glycol is a good example of that. There are different types of propylene glycol. So, for example, propylene glycol is what you put in your car for your antifreeze. And if you drink it, you can drop dead or go blind. It's not good for your dog or cats. Um, that that's a bit different than propylene glycol that is produced from vegetable material, which is generally corn derived and also of a different grade. It's called pharmaceutical grade, which is a totally different um, level of quality and purity compared to what you'd get for use in your car as antifreeze. So I don't think there's any issue related to that question.
No, I have another question for you.
Okay,
Had you finished that?
I finished.
Okay, Tia Live is using the.
It's live.
No, she's live.
Yeah.
She says she's using the Riversol products and has large clogged pores on her cheeks. Will it eventually clear up with what Tia is currently using, which is the gel cleanser, anti-aging serum, and the lightweight moisturizer?
Probably not. Although it will help to some degree, I think that if you have large pores, you need to have some way to exfoliate those to some degree. A topical retinoid, vitamin A acid derivative, would be useful. Glycolic peel may help a little bit to open up the pores and allow you to exfoliate. We're actually developing a retinoid now for that purpose. And again, sometimes we will, depending on the degree and the bothersome nature of it to you, we would consider using certain lasers to help that as well. Let's see.
Here's one. Question from an earlier viewer. Is retinol suitable for sensitive skin?
Is retinol suitable for sensitive? Okay. So again, retinols can be irritating to the skin, and everybody generally will develop what's called a retinoid dermatitis in the first week to month of having used the preparation. That means that the skin becomes a little bit red and has a very fine brand-like scale associated with it. That generally settles down after a week or two, but you do have to acclimatize to it. If you're having somebody who has really sensitive skin, you got to be careful. And I generally tell people the way to get used to it is to literally, first of all, it has to go on dry skin. So you wash your face, you pat it dry, wait a minute or two, and then you put the retinol over the face, avoiding areas like close to the eyes where it's more sensitive, the skin's thinner, and only leave it on for an hour or two and then wash it off. Do that daily for about a week. And after a week, if you are able to tolerate the product on your skin, then increase the duration of time that it's sitting on the skin. So let's say the first week you use it only for an hour, or two on a day. And the second week, increase it to maybe 2 hours a day and then wash it off. After 2 weeks, if there's no major issues, no major redness, increase it to 3 hours a day for the third week, and then on the fourth week, 4 hours a day. So you're wearing it for half a day every day on the fourth week. If at the end of that month you've been able to adjust and tolerate it on your skin, then just apply it at bedtime and wash it off in the morning. And it should go over the entire face, not just over on little spots.
Okay, next question from Kimberly on the Facebook page. She has rosacea for the past 6 months, and now it's become quite noticeable. But her skin is also aging, and she wants to take care of it properly. Can she use the anti-aging serum or other anti-aging treatments? Or is she better off sticking with an anti-redness serum?
I think that if you have rosacea and you're also worried about anti-aging, I would stick with the anti-rosacea, anti-redness serum. Just a little bit better tolerated on the skin. But certainly, you can try it, and the other products you could use off the face if you are not able to tolerate them on the face. So neck, décolletage are reasonable, um, uh, are reasonable to do.
So I just have a question,
Yep.
whether or not I use the products. Yes, I have been using the products for whenever Jason started making them in our kitchen. We had the first idea probably 15, 20 years ago, and I love them. And I do have rosacea, and I used to get redness across here and pimples. And using the serum every day, I do not have rosacea anymore. So I love the products.
It's not bad for 85. Okay, somebody's saying my skin is toned out quite well, but I have large pores of the face. Yeah, again, the question from Tia, it looks like, is
that
that.
one.
Oh, we heard this one?
Yeah.
Okay.
But we do have another one.
We have another one. Sorry.
Azra asks, is there anything we can use for hormonal acne besides birth control?
The answer is yes, you can. The thing that we use often is a thing called spironolactone or aldactone. Spironolactone is a medication that was developed for blood pressure control, but it has an anti-androgen effect as well. So it can be used in people who have hormonally based acne. Interestingly, in the States and hopefully soon coming to Canada, there will be topical antibiotic foams which seem to be effective in dealing with acne and as well do not have any of the systemic side effects. But even more interestingly, I was at a meeting recently in Paris, and there's a company working on a laser that potentially can cure acne or prevent it altogether because it targets the oil glands in the skin. And by destroying those, you can obviously reduce or potentially cure acne. So keep tuned. We'll let you know how that goes.
And Crystal from our Facebook community wants to know, are your products safe during pregnancy?
Crystal, our products are safe during pregnancy. That said, I generally tell people that anything you use in pregnancy, people can relate to things. So, for example, if you have a child who, unfortunately, let's say, develops an extra belly button, and you say, all through my pregnancy, I ate pickles, and I had never eaten a pickle before my pregnancy, it must have been related to the pickle. So you can associate things very easily with that. I would say to you, though, if you're using a product that, especially on a limited area of the body, a wash-off product, that they're safe to use. Certainly, our sunscreen, the body sunscreen, I would say is a very good choice for you during pregnancy because there have been some recent studies that do show that in chemical sunscreens, the ingredients can be absorbed into the body and excreted through the urine. So safety is a reasonable question, and I think our products are good.
So we have a question now from Amanda. She wants to know thoughts on the best treatment for melasma. She's tried brightening serums and IPL lasers without much success.
Okay, so melasma is a condition more commonly seen in women, relates to hormones and sun or even visible light exposure, um, and often seen during pregnancy. It's the other term was the mask of pregnancy. The cornerstone of treatment is really sun protection, so sunscreen. And we have a sunscreen that has iron oxide in it. That's why there's a tint in it. We're trying to actually increase that because visible light also plays a role with this. So by blocking ultraviolet and visible light, we're hoping that we can reduce that component. The second thing is inflammation in the skin, which leads to the production of more pigment. The use of agents traditionally like hydroquinone, kojic acid, arbutin, uh, azelaic acid, for example, have all been used in the past to try and lighten the skin. And what they do is they block the enzymes that make pigment. So it takes about 3 months for that pigment to come out and work its way to the surface of the skin for you to see an effect. We're using topical tranexamic acid, which I mentioned before, and we have, to my knowledge, the highest concentration of tranexamic acid in a topical preparation available in Canada. For people who are really resistant to treatment, I will actually use oral tranexamic acid. And that's another discussion, but it can work very, very well if taken for a few months. And you still have to use it in conjunction with other things. IPL is intense pulse light. Um, if you use it judiciously in certain people, you can have a temporary improvement in the melasma. However, people who have darker skin types, if you use an IPL on them, you got to be very careful because you can actually make the problem worse. We do have a number of different lasers that have been used to treat this condition. And we, again, in our clinic, we use them. They're uh, what we call pigmented lesion lasers. We use a laser called a Fraxel. We use even vascular lasers because sometimes blood vessels are associated with this problem and can make it worse. But sunscreen is number one.
Okay, so Maria, one of your older patients, not older, former patient, um, is 38 and she does have some acne. She thinks it might have to do with hormones, and she also has little red spots that look like damaged blood vessels. What treatment would be beneficial for her, and should she avoid alcohol?
Well, Maria, given the current state of the world, I'd say drink as much as you like. Um, just kidding. Um, if alcohol makes your skin worse, then I would say probably cut down on it. Some people find that red wine is more of a trigger than white wine, so you might find that changing the type of alcohol around a little bit will help you. The second thing is that you've got red dots, then that literally has to be dealt with using a laser or some form of destructive device to get rid of those. Those are, I think you're describing what's called angiomas. The little bit of acne you have, again, can often be managed just with topical agents if it's mild, and that includes a preparation called Axone, uh, which is available for prescription, topical retinoids. And again, we're coming out with our product, which I think may be of use to you as well.
Okay, so I guess we'll read from the screen here.
So Michael writes, I've always had lines or wrinkles on my forehead, lines when you raise your eyebrows, but it's quite visible even normally. I'm not really sure what's caused by it and therefore what kind of product I should use. Well, the bottom line there, Michael, is that as we age, we have a change in the shape of our face. We have a change in the um, bone structure of our face, the fat compartments in our face, and the muscles themselves change. If you're seeing a lot of lines in your forehead, oftentimes it's because there's an imbalance in the muscle action between those muscles that cause you to frown, so this kind of frowning motion in here, and the muscle that lifts up your forehead. In that situation, creams and potions will do very little. What you need to use in that case, and this is where Botox comes in very handy, or Dysport, similar type of product, by relaxing the muscles between your eyes, that tug of war is reduced. So just treating in this region here, you'll find that the forehead itself will relax. At times, however, people who we do this to, even when the muscles are relaxed, they still have deeper lines. And so then I will use a filler, a gel hyaluronic acid filler, to help bring back the uh, proper volumization to the forehead to smooth it out. Interestingly, when you're doing it that kind of approach, the product can last for a good year to 2 years without having to have it changed. Done properly, it's a safe procedure.
So we have Pamela from our Facebook community who has been using the Riversol samples. She says she is on day 6 of the redness reducing program for rosacea, and she's having positive results. She then goes on to say that she's 57 and has hyperpigmentation and fine lines, wrinkles, and wants to know what products she can add to the redness program or substitute out.
Well, I think for now, Pamela, the key thing that I would do is just keep on doing what you're doing. If you're only on day 6, it can take several months to see a change. And even with this program, the fact that you're improving the barrier function of your skin, I think you'll see that some of the fine lines will improve over time. So just keep doing what you're doing.
Judy wants to know.
Judy,
Judy says, do you have samples of the corrector?
I don't think we do, but I'm sure one of our folks back in Riversdale will confirm that one way or the other. And Sutta, I'm using anti-redness and it's been working for me. I've been prescribed Oxy and Fragile cream. Yeah, so the question is from Sue Taz that she's been using preparations for rosacea, including doxycycline and Flagyl cream, which is called metronidazole. I would say, yes, I would use it with that. That the combination often is additive to what we have. And so if you're tolerating it, I would suggest you do that. The doxycycline, I would say, use it for about 4 to 6 weeks because it will take that long to see improvement. If you do have improvement and things settle down, then you can stop the doxycycline but continue with the metronidazole or Flagyl cream.
So the Riversol team got back to us about the sample of the corrector, and they do not provide samples of the corrector, but they're happy to give you a full refund if you're not happy with the results within 60 days.
Yeah.
Then we have another question from Carol. She asked, are there any plans to do a moisturizer with the sunscreen?
Moisturizer. Well, basically, our sunscreen as it exists now is almost like a moisturizer, to tell you the truth. The body lotion is also generally well tolerated on the skin, doesn't clunk on the what's a clump onto the skin. But we don't have plans right now to do a moisturizer with an SPF. Yeah, so we're more of a purist kind of approach, and that is that you'd use your sunscreen and you can put a moisturizer on top of that. And
I just have to find another one here.
I'm just trying now.
The last one, yes.
Okay, any other question? Let's see. Julie, Wendy,
Well, here's one that's just popped up. Shall I read it?
sure.
Sunny asks, can you make a comment on the following treatments and your option or opinion, which is best? BBL, microneedling, laser resurfacing, or the new Halo?
Okay, well, basically, these are all device-based treatments. BBL is broadband light. It's almost like an IPL. It's sort of a trademark, if you will. And I guess the question is treatments for what? The issue is that they all do different things. Broadband light is very good for removing brown spots, some redness on the skin. It's very similar to IPL. It can help the texture of the skin. Microneedling is very popular. People do it at home. You have to induce bleeding. It's basically like aerating your lawn, but use your skin instead. And it's a roller, and the microneedling allows the creation of a very small wound in the skin. And the idea is that that wound then heals, and you get a more youthful, smoother skin. The issue with it is that there are problems with it in terms of consistency. Not all microneedling devices deliver the needles to the depth that they say they're going to do. Sometimes they work, sometimes they don't in terms of delivering the uh, the impact into the skin. Some people have been applying PRP to the skin, and it gets to be very expensive. PRP is basically taking your blood and spinning it down and using the platelet-rich plasma and to induce growth. The only data that I've seen that is reasonable to this point in time with regards to PRP is that it will reduce healing time after certain laser procedures. Very limited data in terms of how good it is in terms of long-term benefit to acne scarring. There may be some uh, concerns that if you put, for example, lotions on the skin that are intended to be only on the skin, and then you use microneedling, you can get some of those particles into the skin, and they can cause reactions in the skin called foreign body granulomas. Lasers, I like lasers resurfacing. I do a lot of that, and I've done that for many years because I know that it gives consistent results. I know what can I can expect in terms of outcomes for most people. But like all of these other things, they often take more than one session to maximize improvement. Halo is another type of laser device. We looked at that for a while. I didn't see any major advantage of it over the devices that we already have in our clinic.
Okay, so we have Frances from our Facebook community. She is 67 and has been using Riversol products, but she's noticed that she's developed some small pustules. She's not saying it's Riversol, just asking if she should still use them. She's using the cleaners, the serum, and the daily moisturizer. She's just a little bit concerned about getting pimples at age 67. Can you speak about when pimples stop coming?
Well, Francis, it seems that our products are making you younger, and now you're like a teen. There you go. So, yes, you can sometimes get little pimples. Sometimes, if you use too much of a product, you can cause occlusion over the skin, and that can give rise to the to pimples. So, what I would say to you is continue to cleanse the skin. Um, Hold off on the moisturizer for a little bit. You can use the serum, and if the pimples persist for a while, then you can just apply a bit of either use a water and vinegar soak, or you can use a little bit of polysporin for a few days and see how you do with that. Hopefully that will help.
So we have no more questions up here. We'll have to look on the screen here.
Okay. Can we have a doctor's note to drink? Yes, send them in. We'll get them first come, first serve.
I did get one that just popped up here. So, Jordan, what is the best way to remove persistent blackheads in the nose? The pores are extremely tight and no exfoliation seems to work.
Okay, so again, for the nose, it's not always easy to do this, but I find that using a topical retinoid, a vitamin A acid preparation, is often helpful, at least help in a little bit. But quite frankly, the best outcome that I've seen is when I use what's called a Fraxel laser. This helps to, in a way, damage the oil glands, and also it will shrink the pores at the same time. It's not a cure, but it will help to minimize the pores. It often takes several treatments, though, spaced at least at 1 month intervals. Sonia writes she loves our product. Thank you, Sonia. Hopefully, other people like it too.
So the people at Riversall are saying that's it, but if you have any other questions you'd like to answer, feel free to do so.
Okay, there's one question here from Alicia. Says, I've used most of your products for over a year now, including the corrector. I stopped using the corrector because although it lightened my complexion, the dark spots started to stand out more than before. Is that something you've heard of before, or am I a weird case? You're not a weird case. That can happen where you're actually getting lightening around the area. It may be that the spots that you're treating are not necessarily the type of spot that will respond to the corrector. As I mentioned before, there are all kinds of different pigmented lesions we have on our skin, and I have to have a picture and see what's going on to really advise you better. Anyway, I hope we've been able to respond to most of your questions. Always feel free to contact us. Remember, we're living in an unusual time. Please stay safe. Wash your hands. Keep your hands off your face as much as you can. And there is a practice social distancing, of which we're sort of doing here. But thank you.